Iron is the most common deficiency amongst women ages 15 to 45. The average North American diet only provides a portion of the required daily iron intake, and women must compensate for the iron loss due to their menses. In pregnancy, iron is essential for maternal red blood cells, brain development, and iron stores for the infant. Thus, it's important for women to maintain sufficient iron levels during their childbearing years. Let's take a look at why iron is essential and what to consider during pregnancy. It's estimated that only 1 in 5 women enter pregnancy with adequate iron levels, which is needed for the placenta development, to prevent preterm labor, postpartum depression, and prevent low birth weight babies. If iron levels are not maintained during pregnancy, it can take up to 2 years to replenish iron stores. This is why it's important for women to start early and get a low dose of iron regularly throughout their childbearing years. Research has shown that 4 out of 5 women can prevent their iron deficiency with 20 milligrams of supplemental iron per day. Pregnant women suspected of having an iron deficiency should consider getting a serum ferritin blood test. It is the most sensitive indicator of this deficiency, much more accurate than the common hemoglobin test. Common treatments are often solid iron tablets that are poorly tolerated and poorly absorbed. However, pregnant women need to be careful with what prevention supplement they choose, as high doses of iron exceeding 50 milligrams per day have been linked with low birth weights, increase of high blood pressure, and premature births. Therefore, I recommend using a non-constipating low-dose treatment like a vegetable-based liquid iron formula such as Salus Floradex during pregnancy. The baby only has iron stores for the first 6 months of life. After birth, breast milk becomes your baby's main source of iron. A baby's brain is very vulnerable during this first year of life, and iron deficiencies have been linked with developmental delays in both motor and cognitive abilities that are irreversible. This is why maintaining adequate iron levels after pregnancy is crucial. Iron production in breast milk requires an additional 0.6 milligrams of iron per day, bringing the ideal daily intake to 20 milligrams of iron after pregnancy. Well, there you have it. For a healthy pregnancy, it's best to maintain adequate iron levels before conception, until your bundle of joy is born, and while you're breastfeeding.